I am so excited to have my good friend, John Gerber, CEO and founder of MEDCOR, with us today. John, thank you so much for doing this with me. I usually do the intro, but I'm just going to have you tell us about your background and how your experience in the healthcare industry and what prompted you to start MEDCOR. So take it away.
Thank you, Hani. It's a pleasure to be here with you. I've always enjoyed working with you, and to be able to share this is really exciting for me as well. So my background is that once I got out of the military, I was a hospital corpsman and came out, got my undergraduate degree in nursing. So I have an RN, I have a BSN, I was a pre-med microbiome major, never made it to med school for lots of different reasons. But ended up becoming a MBA out of USC, University of Southern California, in finance. Became a retail stockbroker, and then from there, I ended up working in mergers and acquisitions for a few years with Payne Weber and Merrill Lynch, and then subsequently after that, ended up working in the hospital sector, where I became a charge nurse, director, and eventually a COO, a C-level for a couple of different hospital systems. I worked 10 years for the Adventist hospital systems in Southern California, where I ran medical group operations. And then at the end of that 10-year run, I was unceremoniously demoted, meaning I lost my job. And so, necessity is the mother of invention, right? So I had to have a job. And so I got together with a buddy of mine. I said, listen, let's do what we really love. Let's go back to doing business valuations in healthcare. And curiously enough, the same hospital that let me go hired me back to do business valuations. And of course, that was the highlight in 2002 of the hub and spoke, the foundation model hospitals, medical groups they were acquiring, selling, and they need to be evaluated. So we would do that. And of course, it always came out to cash flow. It was a major problem. And it always drilled down to billing. So they asked us, well, can you do the billing for us? I said, well, no, we don't know anything about medical billing. And to be frank, and I've told you this, and I tell everybody this, I still don't know a lot about medical billing. I know if to get into trouble, I know the nomenclature, the vernacular, but we're pretty good operators. And so we said, give us your people and we'll manage them and we will do the best that we can. So that was about 2002, 2004. And in 2006, I bought my very first own billing company out of Escondido in California. And we were in primary care at the time. And if you all can appreciate primary care, there's not a lot of money in primary care. The margins are very, very thin. I remember margins used to be as high as 14% commission rates. Remind you, that was 20 years ago. And then, every year thereafter, those reimbursements started to get smaller and smaller, and the commissions began to fall. So we were almost broke in 2010, and we went from 15 employees down to 3 employees. And I was about ready to get out of the business, go back into hospital care. And I just said, we're smarter than this. We've got to do better. And so I made 50 phone calls. I got 1 referral. And from that, now we are in 13 states. We're from California to New York. And we'd like to consider ourselves as one of the leading federally qualified health center revenue cycle management companies in the United States now, with over 100 employees.
That's amazing. Your growth is just astounding. Whenever I come visit your office, I'm always amazed at how much you're continuing to grow year over year. It's just a beautiful thing. But what made you go into the FQHC? And for those of us that don't know what FQHC is, explain what, because you're in a very niche market, and I'm curious to how you went from internal medicine to FQHC.
Well, it's serendipitous. This is how these things happen. We didn't plan to do it, but we were broke. We had no business, and somebody came to us and said, "Hey, do you know how to do federally qualified healthcare center medical billing?" I said, "Well, what is that?" "Well, it's family pack, it's women's healthcare, OBGYN, primary care." "Oh, we do that. We can do that." We had no idea what we were getting into. Fortunately, they were a brand new federally qualified health center clinic. Community health center is what they were called. And we learned with them, and we learned how to bill. So we had small people, and then that begat another clinic. And then we began to get more facilities. We got better at what we did. It took us a while though to learn that, because even after 2 years, we were still struggling. And then you get the whole other side of that business, which is how to manage people, how to manage the business, how to manage clients, how to scale. That probably was really difficult for us for I would say at least 7-8 years. How to scale was really important. You go from being an entrepreneur to being a manager, and next thing you know, you're bringing in business. But getting business is maybe easier than keeping the business, right? So you have to be careful about how you do that. And it took us a while, but I think we've got the secret sauce now. So for 15 years, we really didn't do much. We stayed between the $1 to $2 million range, and it wasn't until about 2015, 2016, we began to have dramatic 30, 40, 60% year-over-year growth. And I think we found the secret sauce. Yeah.
That's remarkable. So, and you're still in the FQHC kind of niche. Like, are you just taking
Yes.
FQHC clients?
Yes, that's all we do. I would say 99.9, and that 1/10 of 1% is our very first and only primary care medical practice. And that's because he's my PCP. Okay, so we hang on to him. I like the relationship I have with my doctor. So it's a two-man office, but we do not take on. We actually refer out primary care because we get calls for it. Hearing aid
Right.
billing, primary care billing, orthopedic billing. We don't want to deal with it. And some of it's lucrative, but we just don't. It's not in our wheelhouse. We're not expert at it. We are experts at one thing, and that is the FQHC and community health center market space.
I love that as an entrepreneur, you realize that the riches are in the niches, and you just really honed in on that target customer. I think that's wonderful. So I know that you have your children in your company, your 2 sons, Jason and Jonathan. Tell us, what role they play and what it's like working with your kids. Talk to us about that.
Well, it's a really great story. And by the way, everyone will tell you never to have a family business. Okay, do not hire your children. Don't do it. Jason was with me since day one, and my director of operations tried to fire him like 2 or 3 times. He just, we weren't medical billers, right? So you learn as you go. Today, Jason is a industry expert, and he's incredibly recognized as a leader in the FQHC market space. You can't go anywhere and talk FQHC to large organizations without them saying, yes, we know Jason Gerber. So just really proud of him and what he's been able to do. He is really good at what he does, talks well with people, and he's solution driven. And he doesn't know how to say no. That's the only problem that Jason has, is that he is a yes guy, because he's always trying to figure out the solutions for the clients. Right. So my other son is a CPA. We did not allow him to come into the company until just a couple of years ago, because we wanted to make sure there was 2 issues. One was, when you're a smaller company, you don't want to be reliant on being the sole source income for your entire family. If you go down, everybody goes down. So that's a high risk proposition, and I was always concerned about that. The other is that I did not want a family member who had just gotten some education to come in and then learn on the job. I really wanted him to have value add to bring to our organization, and it's been amazing to watch. I'm really blessed to have 2 very bright boys. I'm blessed that they're critical thinkers. They ask questions. They include me in the process. It takes a while to understand the dynamic between, you have father and son, you have CEO and CFO. So there are 2 things that you have to be aware of. We have father and son conversations, family conversations. From the strategic side, we always look at, well, where does this put the family? Is it good for the business? Is it good for our client? The other is their personal growth, and where do they want to go as we continue to grow the business. So for me, I'm very fortunate. I'm very blessed. I have two fantastic children, but they're also really good at what they do.
That's great. And John, I've known you for a long time, and what's I think remarkable about you and your personality is the way you relate to people and the way you build relationships with people, I think is just remarkable. Going to dinner with you and just seeing how you interact with everyone you meet is just a beautiful thing. And you must have some really great practices that you do to like keep these relationships so tight, because everyone that I see you interact with seems to like love and adore you. And I just wonder, like, do you have some principles that you live by when it comes to relationships, and how are you building such tight, close relationships with all these people?
Really, really good question. I would tell you before, I would say I don't know the answer to that, except I can tell you it was never really about the money for us. My father told me a long time ago, don't chase the money. All right, just do the job. And I never really understood that. Not being, I never owned a company before. I started 20 years ago. But don't chase the deal. Don't chase the money. Let the deals will come to you. Believe it or not, they actually do come to you. And there's enough business out there for everybody in the world. So don't get stressed about, God, I got to close another deal. Well, of course you're stressed. You got to meet payroll. You got to take care of your family. You got to take care of a lot of other people. But eventually, if you do your job, people, product, processes, those three things, PPP, people, product, and your process. If you work on those things, get the best people that you can, work on the process, make sure it's good. And so you can deliver a quality product. People will recognize that and they will come to you. There's also one more thing. I live by Don Miguel's, the four agreements, okay? One is, obviously, don't make assumptions. Well, I always make assumptions, right? Don't take it personal. Well, this is a crazy business. I take everything personal, right? If something goes wrong, always do your best and work with others. So, I try to I do that with my orientation and service. Every new employee that comes in, I actually have a CEO orientation where I sit down with them over lunch and I talk about who we are as an organization. And it's important that we do this throughout our entire enterprise. And we try to embody that as much as we can. The other is that we're a solution-driven company. I have never pitched really MEDCOR ever, the MEDCOR group. I don't think I've ever really pitched them. Somebody says, well, what do you do? I said, why is your billing company different? I said, I don't know the answer to that. All I know is, hey, you got a problem, and we're going to do everything we can and bring all of our technology and our people, our skill sets, our experience to solve that solution. And if it works, it works. If it doesn't, it doesn't. We fired clients because we didn't work well with them. We didn't like them. They didn't like us. So we said, let's separate. So all of our
Right.
clients that we do business with, we actually have a good relationship with.
I think it looks like you treat your clients and everyone you work with really, really well. Because I was talking to, when you weren't looking, I was talking to the waitress in the restaurant we went to last month, a couple months ago. And she told me about how you wrote her these nice little notes, like thanking her for her service. And I was like, wow, that is amazing that you are writing notes to the waitresses. I'm sure that extends to like your other relationships as well, that you're very thoughtful and intentional.
I had, I grew up in the hospital system and all my mentors were women. And so I've been really lucky. I had a phenomenal mother. I had 3 sisters. I didn't have any brothers. So I've been surrounded by women my entire life. And, I've been called all sorts of things, arrogant and egotistical. And, they keep chipping away. And it does make a difference after a while. And you just learn to appreciate other people. Life is hard for everyone. And if you just share a little bit of yourself and appreciate what they do, it makes life a lot simpler.
I think that's a beautiful thing. And that was like such a great takeaway when I was talking to that waitress and I started thinking about, I should get into this practice of like doing this sort of thing. So thank you for teaching me that. Okay, so you said everybody has hard times. What are some of the biggest challenges that you're facing right now as an entrepreneur, or what are the kind of things that keep you up at night?
Well, first thing I would say is infrastructure. Uh, each company, whether you're 10 people, 20 people, 50 people, 200 people, there's one thing that's going to be always a common denominator. How do you scale? How do you find good people? And then if you're a small company, you can manage it all yourself. And small, I would say 50 and under, you can manage it yourself. You start getting into the larger numbers, you have to bring people in who are talented. You have to be able to give some of that up. And for me, I'm the chief visionary officer now. I'm not really the executive where I did everything before. I still sign off on things, but now the ideas and the processes are being done by our supervisors, our managers, our directors, the administrative level people. So infrastructure is really important. Find the best people that you can, bring them in. Don't be afraid to let them go and make mistakes. It's going to cost you. It's going to be painful, but you learn through those. They'll learn through them. Invest in your people. That's the other thing. Don't just give them a salary and say, okay, I'm paying you a check and I expect you to be something that you don't even know what they're supposed to be, right? So invest in your people, bring in talent, education. I'll give you an example. We had 7 new supervisors and they were basically on the job training. So we did 2 things. One, we brought in a world-class management training program from Cal State Fullerton, leadership skills class, and that went on all summer long. Cost a lot of money to do it, but you know what? Our people responded, and they are really more independent today than they were. And then we also overhired people, meaning that we brought in people that had jobs that were much bigger than we were, because we knew that we were going to get 50. We knew we were going to get to 100. We know we're going to get to 150 people. And I want the people there in that infrastructure ready to go so that we're ready to go to 200 people. And you just need to layer the people in properly. So scaling, it means all sorts of different things, right? But scaling from the infrastructure side was one thing. Okay, let's talk about scaling on bodies, manpower. It's a real problem, especially today. Everywhere I go, everyone is always talking about scaling. And you know this, when we worked with you, we couldn't scale fast enough. And we got these really large accounts where you need 10, 20 people at a time. That's a real problem. So you need to have a connection or a resource that you can either use temporarily, permanently, temporarily. It needs to be flexible, but they need to be able to have the capacity to scale as well. Knowledge of those people that are scaling with you. So you're going to have multiple disparate EMR platforms. We're very fortunate. We only work with 5 or 6 platforms, but primary care or specialty practices, those billing companies may work with 10, 12, 13 different practices. And I don't know how they do it. So there may be a reason why you want to, shrink that down to become simpler. So, it's the old KISS, right? Keep it simple, stupid. Yes. So we try to practice that. We try to lower to the lowest common denominator so that we we don't spend a lot of time, worrying about it. Those are probably the 2 biggest things: scaling infrastructure, scaling manpower. And finding the right kind of leadership as well. Finding clients is not the problem. I have to tell you, once you start rolling, and once you understand how to market properly, and by the way, we never advertise. We have never, quote, marketed. We do social media, but we hired somebody just to keep us relevant. But we branded ourselves, and that was the difference. I began to realize I was never getting anything for the marketing and advertising dollars. Cold calling never worked. Direct mail never worked. I never got a client from any of that. It was all through relationship building. And the time will come when they'll recognize who you are because they recognize your brand. And then that will help make the decision to use you or hire you as an organization.
So would you say that your relationship building skills are really what helped you the most in scaling your business? Just the word of mouth.
Yeah, okay, that sounds like it's a really specific thing, relationship building skills. I think it's all of the above. I think you can't have one without the other. The branding for us, when we didn't know what we were doing, we just took a flyer and we said, listen, let's just get the MEDCOR name out there. And along with the MEDCOR name, we'll bring ourselves. And so we're actually branding ourselves as well as MEDCOR at the same time. And it seemed to work, real well.
And you're going to a lot of industry conferences, right? So you're
Oh, we do.
putting yourself
Yeah.
out there.
I will tell you, curious enough, how we began to exponentially grow was I began to speak at a national conference. And so we went from primary care to become a hearing aid medical billing company, which is very strange. And I don't advise anybody to do that. But we became one of the largest hearing aid companies in America, just because we got a hook into a company called Amplifone, one of the country's largest distributors of hearing aids, and they needed to have somebody who could do medical billing or for hearing aids, and became knowledgeable. So we became knowledgeable. But that is a really tough business, and the margins are really thin, and they're energy vampires. So stay away. Let somebody else deal with that.
But that's when you started your speaking. That's how you got into the
Yes.
speaking circuit. That's very
Highly
cool.
recommend that. Highly recommend
Yeah.
that.
Being a thought leader in the industry is huge, and sometimes costs nothing to do, but definitely a great way to stand out amongst everyone else. Okay, I really want to talk about your bots because you and I talk about this all the time. And I know for a while you weren't ready to talk about it, but I think you're ready to talk about it now.
Okay.
So I know so many
Sure.
billing company owners, and I know very few people that own medical billing companies that are investing in bots. So talk to us what that experience has been like and what you've learned to kind of help other people that are thinking about this figure out what they should do.
So let's just call it a journey. Okay. So 3 or 4 years ago, like probably most of your constituency here, we went to the HMA conference, and I heard a gentleman talk about robotics and AI and how it was going to replace medical billing services and companies. And it honestly just scared me to death. I said, oh my God, I'm going to lose my company before it's really off the ground. And they're going to have all these nanobots doing medical billing, and I better figure out how to do that. Well, we didn't have any money. We didn't have the bandwidth to do this. And they were saying, well, it's only $9,000, $10,000. And we didn't even have the money to do that. So a couple of years later, finally, we got the bandwidth. And I said, listen, let's take another look at this. Now the term was AI. That was the buzzword. And it's still the buzzword today. It's not true, everyone. It's not AI. It's algorithms. That's all it is. It's your work process that's been automated technically or digitally. So what we did was, and this was our journey, is that we did not understand what the cost was going to be. And I'll just tell you right now, after 3 years, it's about $500,000. We've gone through 3 different companies, and every company will tell you they can help you do it. They know how to do coding and programming. But you know what? That's not true. Not a lot of people, even though they say they know how to do healthcare billing bot development, that really is not correct. What they're doing is they're doing eligibility, they're doing claim status reports, they're doing prescriptive, they may be doing some analytics. But what they're doing in healthcare really is a very small piece on the RCM side, and yet that's the biggest impact. Our concern is that what is the biggest way that we can recognize savings, not only for us but for our clients as well? Where's the biggest margin at? Well, it's manpower. is payroll. I mean, if you have a payroll that's $5 to $8 million or $10 million, if you could reduce that by 30%, you just wrote yourself a check for millions of dollars. If you can imagine what that means to your client. So then we started down this process, and we actually have been able to complete up to 70% to 80% charge entry across our system, our enterprise. So it's really amazing to watch it work. It takes, it's about 5 times as fast as a human person, but it's dead on accurate. It's 99.8% accurate. If it makes a mistake, it's because you wrote the algorithm wrong. Or there's been an update in the EMR platform, or there's been an update in Medicare or Medicaid. And you have to, it needs maintenance. So you need to be monitoring it. I will tell you that the journey can be very frustrating. You know, and if anybody wants to call me and talk to me about it, I'm happy to do that. So you don't have to go through what we did. So we've gone through our 3rd iteration of a company that is actually designing the bots for us. Now the question is, are we ready to invest in having our own team do it, meaning a project manager, a bot, a coder developer, and we have a part-time one already on staff. We have full-time work project management person on staff, and that's critical. Then you need somebody who's going to do edits and watch the denials and rejections and then recode. So it's a really synergistic, very vertical related integration. So you have to have a lot of pieces that go into place. I will tell you that once it gets done, it allows your mundane tasking to be done by a bot. Those people can be moved to accounts receivable, or they can be moved to somewhere else. So that helps us with scaling when we go in and we do it. And if we have a massive billing problem, like we have 20, 30,000 claims that need to get out in a matter of days, we can do that with a bot. We can design a bot. It takes a couple of weeks to do that. And now, before it took us 3 years, right? But now we can do it in about 3 weeks. So that will, I think we did something like 35,000 claims literally in a few days for one of our clients that had a project. Can't tell you who that is, but certainly it was amazing for us to watch. Yeah, and I think we got about 80% of the percentage of the claims, and the rest was manual, of course. And then people always want to ask, well, what was the denial rate on that? I don't have that, but you're going to get some denials. But
Okay.
at least you got
So,
them.
but you solved 80% of your charge entry issue by, instead of having humans manually do it, now you have the bots do it. So I'm assuming that's a pretty significant cost savings, right?
It is. And, you know, we haven't really recognized it per se, because we move those people to new
Right.
clients that come on board. So, I mean, the challenge is, well, what's your ROI, right? And we keep saying, well, you know, we don't know. We're trying to get our arms around it. But, you know, industry will tell you the ROI can be anywhere from 5 to 12 times multiple. You know, we're not seeing that. But I always said, hey, look, if I can reduce or I can optimize our processes, on one side is the ROI, the other is optimization, and
Right.
the mundane task where you have rejections and denials because of something stupid like keystroke error, or they're out sick, you know, they have childcare issues. I mean, you name it all. I mean, you guys know what that looks like. Well, a bot never takes a break. It works 7 days a week. And for all the owners out there, they never ask for a raise. Okay. Not to say they're not cheap, okay, but they're reliable and they're consistent. But it's how you build it. Again, it's people, product, and process.
Okay. So, and are they doing any payment posting at this point? Like, do you have any bots that are payment posting?
Yes and no. Payment posting is can be a challenge if you think about the nuances. You can do Medicare very easily. Blue Cross is really simple. So we are working on that now, and we suspect that certain clients will be more easy than other clients. So each one of your clients is going to be different. There will be some there'll be some advantage in being able to roll out across the enterprise. So let's say that we do 3 to 4 million claims, let's say a year. All right. So 20% of those may be Medicare claims. And if we can do 20% claims or payment posting, well, if you've got 100 people and you've got, let's say 15% of those are payment posters, then you're going to be able to reduce those FTs and put them over to the accounts receivable side. Yeah. So there is an impact and there's a value.
I'm curious about if you have ERAs where you auto posting claims anyway, does it even make sense to invest in a payment posting bot to post the ERAs for you? Like, how does that work?
It depends upon your volume and it depends upon the nuances, because if you, well, with auto remittances and whatnot, there actually is very little difference in that, except that the bot can manage different pieces like a human can. Whereas if an auto posting doesn't always do that, it may not recognize certain nuances that you can have the payment posting bot do that.
Interesting. Okay, so right now your bots work with ECW, right? With eClinicalWorks. Is it work with anyone else?
Epic.
Okay.
And
nice.
I think we're moving to next gen.
Nice.
I know Cario is using bots, their own bots, for themselves.
Nice. So if
But
anyone,
it's agnostic, I should tell you on it.
right?
Bots are agnostic; they can work with any system.
Okay. Okay. So are you at the point where you're ready to license these? If someone's interested in purchasing this for their system, are you at the stage where you're ready to license them?
We signed our first contract a couple weeks ago, actually. So
Awesome. That's
it
great.
is very interesting. Yeah. I think it's very specific, and I want to be really careful. Bots don't, they're not the panacea. They're really not. They're a tool in your tool chest for a very specific set of rules and rules engines that you might have. They're no different. They're a digital worker, but they're very specific at what they do, and they do one thing very, very well. By the way, they do bad things very well too. So if you wrote the wrong algorithm, you wake up in the morning, you have 10,000 claims you've got to manually fix. That's a problem. Yeah.
Oh man. Okay. So you got to really know what you're doing. Are you working on doing anything on the AR side and the RCM side with the AI?
Well, I think that's probably going to come from analytics. AR is a tough thing to do because it requires critical thought, right? Yeah. And everyone says, well, we have machine learning bots. That's not true. Okay, there is machine learning, but it's probabilities. So a bot will actually understand that if it didn't go, if I submitted it over here and got rejected, and then I can resubmit it over there and it got accepted, that means I have a 50-50 chance of doing it right. So you have a 50-50 chance of doing it wrong at the same time. So bots learn from that way. Now there are higher level bots that actually manage the lower level bots. And we haven't got to that yet. And that is bordering AI, but it's not really AI. It really is all algorithms. It's whatever you write, that bot will do. They just become more sophisticated. I think that in the AR arena, it's going to be very selective in what you do. They're not going to, like charge entry, you can do almost all the charge entry. On the AR side, I think it's going to be harder to do, number one. And there's a reason why, by the way. Have you ever heard anybody that does a bot in AR? I haven't. There's a reason why, because it's very, very hard to do. And it's a heavy lift. And somebody once told me, Jonathan, is the juice worth the squeeze? And you're absolutely right. No, it's not. Spend all this money doing this, and what you get this little tiny segment of the market, and it's not worthwhile. So you want to be very careful.
Interesting. So we're working on a bot in India with our developers on the AR side for the note responses. Like, so everything that doesn't have a response goes through this, kind of website check where you want to see where the claim is at. That we've figured out we can certainly, create a bot, and that could work fine. But I think you really have to figure out, okay, what problem am I solving here? And it has to be a big enough problem to be worthwhile. Otherwise, yeah, absolutely. So now that you've, $500,000 into it as we talk today. How do you feel about all of it? Like this whole journey that you've taken over the last 3 years?
Yeah, somebody asked, well, do you wish you'd never done it? And I said, yeah, well, sometimes, yeah, I thought that, but I think it's the future. I think you
Yeah.
have to do it. The question is for smaller organizations, how do they participate? Because you can't build your own bots. It's too expensive. You can't have your own project managers, and you can't have your coders and programmers. I mean, these people are getting paid $150,000 to $200,000 a year. You're going to have organizations such as yourself that are going to be able to provide those services. So I think that that's going to be the next wave, is that they're going to be RCM or allied companies that provide these services to smaller organizations.
Okay.
And
Well, that's
even
wonderful.
even
Yeah.
even larger companies, they can't develop all the bots themselves as a rule. And they'll
Yeah.
be, if you look at Optum, they're willing right now to talk to people, help build bots for them as well.
Yeah. Well, it's a much quicker way. And it takes visionaries and entrepreneurs like you who are ready to take those chances. So it's really impressive. Okay, as we wrap this up, and you have been in healthcare for so long, what excites you about the future of healthcare? Like, what do you see? I know, you've seen a lot of changes over your lifetime. Tell me about what you see up ahead.
Jeez, I don't know. You face this thing with intrepidation, right? I I'm not really sure how to prognosticate what's going to happen. For years, we thought there was going to be a single payer, but we know that's not going to happen. I think that uh, there's going to be more institutional reviews, and I think paperwork's going to get harder. I think that's good for revenue cycle management companies or billing companies, because doctors aren't going to be able to do that. So I think there's going to be a higher push to outsource revenue cycle management. They can't do it internal. Staffing is a problem on the internal side. Training is a problem on the internal side. Unless they've got 100 billers in their organization, and they've got, the Conifers of the world. I don't even know some of the other large, but people that have 1,000 to 2,000 people, they have systems in place. They've got technology in place. But a 10 physician practice, 100 physician practice, even, we have 300 physicians in a practice, and they don't have the bandwidth to provide OIG oversight, coding oversight, audits, compliance. And I would tell everybody that's out there right now that is doing RCM, if you're not involved in audit and compliance on coding and claims, you should be looking at that as an ancillary book of business to grow your business as well.
That's great. That is great because they do need it. And to be able to provide that as an add-on service, I think is really great. John, this was so nice chatting with you today. Where can people find you?
Well, you can find me at our website, which is www.medcorinc.com, or you can email me at jon@medcorinc.com, john@medcorinc.com.
John, it was a true pleasure. Thank you. Thank you for spending this morning with me and chatting with me. I just always enjoy our conversation. So thank you.
Well, such a privilege. Thank you very much.